Good afternoon, this is TTT Live and TTT Live Online on Facebook. I'm Dike Rostant with a COVID-19 review. A retired University of the West Indies lecturer has died from COVID-19 in Jamaica. Professor Tara Dasgupta of the UWI Mona campus, who tested positive for the novel coronavirus disease, brought the number of confirmed COVID-19 fatalities in Jamaica to 6 on Monday evening. Jamaica's Chief Medical Officer, Dr. Jacqueline Bisasar Mackenzie, while speaking at a virtual press conference held at Jamaica House in St. Andrew, confirmed that the professor, who had underlying conditions, died suddenly. Professor Dasgupta joined the staff at the UWI in 1974 as a lecturer in physical chemistry. His reputation for considerable research output was of high quality, and only 6 years after he joined the university, he was appointed the first professor of inorganic chemistry. Now for a look at the effects of COVID-19 in the Caribbean region. Jamaica's Prime Minister Andrew Holness has taken a decision to tighten curfew restrictions in Jamaica after it was announced on Monday evening that the island had over 220 cases of COVID-19. Effective April 21, the curfew will start at 6 p.m. and will end at 6 a.m. It will run for 14 days. Prime Minister Holness also announced that educational institutions are to remain closed until May 31. He added that all ports will also remain closed until May 31 with controlled re-entry of Jamaicans subject to the established protocols.
There is absolutely no need for panic. The society is going through a reconfiguration of how we do business and how we live in order that we can survive. The government has no intention whatsoever to deprive you of your livelihood, of your food, of your medicine, and all the essentials and necessary things of life.
Grenada's Minister of Health, Nicholas Steele, has indicated that Grenada might be into the community spread phase of COVID-19 following the hospitalization of a man at the island's Lone General Hospital on Sunday. He said the man is currently isolated in the COVID-19 section of the General Hospital pending test results.
Till now, all confirmed cases of COVID-19 in Grenada have been imported or import-related. This current individual in question has no travel history, and currently officials are yet to determine whether he has been in contact with any of the previously confirmed cases. Health officials have been in discussions with the employer of the individual.
Over in Barbados, the Minister of Health, Jeffrey Bostic, announced that his ministry intends to increase the number of persons being tested for the COVID-19 virus. The island has secured 27,000 COVID-19 tests and 2,800 swabs. The minister said the increase in testing will ensure that all of their bases are covered.
We must not drop our guard. We must not drop the level of defense that we are putting up against this enemy. Should we decide to drop guard, Barbadians and residents, that would be a sign that we are retreating. And as I've said before, no retreat, no surrender.
The Prime Minister and the Minister of National Security have spoken to the fact that more than 38,000 nationals of Trinidad and Tobago are outside our borders. Dr. Dominic Jaikaransingh is one such national. Currently one of the doctors on the front line in the United Kingdom amidst the COVID-19 pandemic, he has recovered from the COVID-19 virus after contracting it from one of his patients. We now speak with the goodly doctor. Welcome, Dr. Jaikaransingh. Where are you currently based? And please describe what type of approach you and your colleagues are taking.
Sure, thank you. It's a pleasure to be on today and be able to speak to you. I'm currently based in the Thames Valley region, which is the region just around Oxford in the United Kingdom. The approach we took varied as time went on. In the early days of the COVID outbreak, new guidance was coming out every day with regards to how we manage patients, what PPE to use, which patients should be tested. So it's actually quite a complicated time and quite confusing for frontline staff. And, it didn't aid the spread because a lot of us were seeing patients who actually had COVID without the proper PPE, and we weren't testing as many patients as we should. Obviously, as time has progressed, the guidance has been clarified. We have a better understanding of the virus and how to treat it. And I think we are doing quite well. The curve in the UK has actually made a downturn this past week with regards to number of patients infected and deaths. So I think we're going in the right direction.
Now, are you the only person among your colleagues to contract the virus? We're grateful that you've recovered, though, but I'm wondering about that.
Of course, unfortunately not. Again, in the early days, people were going off sick, but healthcare workers weren't being tested. They were saving the tests for patients. It progressed that we did start being tested, sort of unfortunately, but fortunately, when I did contract the virus and start showing symptoms, I was able to get tested and subsequently tested positive. And there are a number of my colleagues who did test positive, doctors, and who had to self-isolate for a week-long period. And then after that week, it was a 48-hour interim period after your last fever that you were able to come back out to work. Unfortunately, in the UK and in my hospital, we've had some allied healthcare professionals who have had to be admitted with quite severe disease with the COVID-19, subsequently having to be ventilated, needed oxygen, and some are even still on the ICU intubated. And, we're hoping for the best for them.
As do we. I want to come back to the point of self-isolating or self-quarantining. But before that, though, take us through the process of presenting to recovery. Personal experience.
For myself or typically what we do with patients?
Your personal experience, thank you.
With patients. So typically patients present having been screened by their GPs, showing symptoms, most commonly cough and fever. GPs are using telecommunications to have these consultations with patients, and they're able to screen these patients first. If needed, they come into A&E. We get their vitals done. We get their observations done. We're primarily looking for how well their oxygen is saturating, so how well their lungs is allowing oxygen to enter the body. If there is a discrepancy, if they have low oxygen saturations, our ears sort of stick up and we're paying more attention to these patients. We do a full assessment, obviously using full PPE. We do blood tests, we do chest x-rays, which have actually been very useful. The COVID-19 has quite a distinctive pattern to be seen on chest x-rays. So we're able to then obviously swab the patients and admit them to the relevant level of care that they will need, whether that is we can get them onto a respiratory ward where they can get oxygen treatment, or if we need to think a bit more, when they're needing more oxygen, we get them to a high dependency unit or even intensive care. Unfortunately, with the patients who've been admitted to HDU and intensive care units and who have had to be on ventilators and subsequently intubated, we're finding it quite difficult to get these patients off of the ventilator or extubated. Primarily with elderly patients, patients with underlying health problems, specifically respiratory and cardiac problems. And we're actually finding that some of the hardest patients to manage are patients who have a high BMI, meaning that they are obese or overweight. Once we can get patients oxygenating correctly, we de-escalate their management. So whether that means extubating and then having them on ventilators, and then bringing them down to sort of masks or nasal cannula for oxygen. There's quite a slow process getting them off the oxygen. But once they're off the oxygen and their symptoms start to wane, so they are no longer having fevers, no sore throat, things like that, we can then think about getting them home.
But in terms of getting them home, you did not have to be, you weren't hospitalized. How does that slow, that lengthy process, how does that juxtapose itself against your personal experience having gone through and you're on the other side of the tunnel now? Because from what I read, one of your last symptoms to present itself was the cough. So what else was there? How did you feel? Describe that process, please.
So my symptoms started late one Saturday evening. I was off of work, I was at home, and I just started feeling quite unwell. I am probably one of the few doctors that doesn't have a thermometer at home, but I thought I was feeling a bit feverish. I went to bed, a bit concerned. The next day, I just had extreme exhaustion, meaning, I couldn't even keep my eyes open. I slept probably 15, 16 hours that day. Then the body aches and the headache started, which were actually quite severe. The body aches felt like, sharp stabs all around my body, the headache. I was taking paracetamol and it wasn't really doing much, making much of a dent in the pain. And you're very correct. Only about 4 days into the disease did my coughing present. It started off quite mild, coughing occasionally, but it progressed to quite severe coughing fits where I'll actually get out of breath. I did obviously call into my occupational health team, things like that, keep them abreast of what was going on. When I was having the shortness of breath, I did call my local GP and have a consultation with them. I had my vitals done and I was oxygenating well enough for them to think that I can stay at home, monitor my cough, and just keep isolated until my symptoms had resolved correctly. And subsequently, after about day 12 of the virus, my cough waned. I was back to, I'll say, about 90%. I still get tired quite easily and quite short of breath, doing simple things like going upstairs. And interestingly, with this virus, you can have a cough continuing even after you're not infective, and for about 6 weeks.
In terms of the fact that you were able to call in, speak to individuals, and self-isolate, did those measures apply for you as a healthcare professional, or is that something that is happening a little more broadly across the board?
It's happening broadly. Everyone in the UK is encouraged to call in. There's a number here, 111, which you can call in and speak to a healthcare professional, typically a nurse, and they then speak to you, find out what's going on, and they triage you whether you need to speak to a GP or go to A&E immediately. I followed the same process as everyone else. They didn't think that my symptoms were severe enough, nor did I. I just wanted to get my oxygen levels set as I was short of breath. So I saw my GP and I had all my vitals done and things like that. In terms of healthcare professionals, the NHS has actually been very kind to us. Unfortunately, when I fell sick, my parents were actually visiting from Trinidad. So they're staying in a tiny little 1-bedroom flat with me and I've tested positive. So it was my major concern to pass it on to them. I got into contact with my trust, so my hospital, and they kindly put me up in a hotel so I can properly isolate from my parents, so which is where I am now. And my parents are staying at my house in Oxford.
All right, so we're thanking you for your time, Dr. Jaikaransingh. Dominic Jaikaransingh is a national of Trinidad and Tobago, currently based in the Thames Valley. He is a medical practitioner and on the front lines. And we once again say thanks to all of the individuals on the front line doing what needs to be done during this pandemic. It seems as though he maybe want to get a thermometer after it is finished, but that is what is trending on COVID-19. Remember, you can join us for live coverage on TTT, Talk City 91.1 FM, Suite 100, Next 99.1 FM, as well as on Facebook at TTT Live Online for all your COVID-19 updates. Thank you for joining us. On behalf of the TTT crew, I'm Dike Rostant. Bye for now.